Welcome back. Have you tried everything but just can't get relief from that aching shoulder? You may be a candidate for shoulder replacement surgery. Dr. Donald Ozumba of OSM Orthopedics at Sports Medicine Clinic of North Texas wants to help you ease your pain. Dr. Ozumba, great to see you this morning.
Good to see you. Thank you for having me on today.
You bet. Let me just ask you a basic question. What is shoulder replacement surgery?
Well, the shoulder is a ball and socket joint, the ball and socket joint that's surrounded by some ligaments and some tendons. There's a cartilage cap that covers the ball and the socket that over time can be susceptible to wear and tear that can lead to pain and debilitating function, painful loss of motion and so forth. Well, essentially, for people who suffer from that, there's an option in shoulder replacement surgery, and what that is actually replacing that worn cartilage with metal bearing. So on the ball side, we'll replace it with a round ball, and there's a metal stem that goes into the shaft. And on the socket side, we're able to replace it with a plastic, liner. Okay, and that typically will alleviate a patient's pain and allow them to have a more restoration of their function. It's something that's usually a treatment for arthritis, and there are various things that can cause arthritic conditions.
So let me ask, what are some of those conditions that can cause it, and what are some of the signs and symptoms you should look for to know you possibly may need a shoulder replacement surgery?
Well, there are three main causes. Osteoarthritis, which is generally just kind of a wear and tear arthritis, where that cartilage cushion cap that's on our ball and socket joint wears down over time. There's inflammatory arthritis, like rheumatoid, and then post-traumatic arthritis, which is something that results from a prior injury. All those things can lead to wear and tear, wear and tear of the joint, ultimately culminating in pain. Symptoms of pain, loss of motion. People may experience clicking, popping in that shoulder. Oftentimes, individuals will maybe talk about having difficulty reaching in the cabinet, their wallet.
Right.
Women will complain of reaching their bra or unclasping their bra. Those are some common symptoms that you might experience or people may complain of.
Okay. Are there any options available before proceeding with shoulder replacement surgery?
Yeah, well, there's some conservative things that can be tried initially, and those things include over-the-counter medicines such as non-steroidal anti-inflammatory medicines. We can also consider injectables like steroid, ice, moist heat, physical therapy. Those are some things that can be tried. If those things fail, we can try more aggressive intervention, like using minimally invasive surgery with the arthroscope and going and cleaning out the shoulder, maybe addressing other pain generators like a rotator cuff tear that might be present.
Okay, what's the difference between a standard total shoulder replacement and then what you call reverse shoulder replacement?
Sure. Essentially, in a normal shoulder that has a functioning rotator cuff, like the one we have here, the rotator cuff can serve as the primary motor to rotate that shoulder and control your shoulder function. Some people have rotator cuffs that have failed and don't work, and those individuals, the mechanics of the shoulders have completely changed. And so in that case, as opposed to doing a standard ball and socket replacement, we reverse it. You put the ball on the socket side, and you put the socket on the ball side. The deltoid muscle, which still works, then becomes the motor for the shoulder, and it allows these people to again have better function than they did prior to.
Okay, Dr. Ozumba, appreciate you coming in and giving us a demonstration. Appreciate it.
Thanks for having me.
All right, you bet. Anytime. For more information about shoulder replacement surgery, log on to drozumba.com or osmortho.com. You can also call 855 OSM Ortho. That is 855-733-6766. You can also find out more by calling Pine Creek Medical Center. That number 214-231-CARE, or log on to pinecreekmedicalcenter.com.